As the situation unfolds in recent devastating Eastern Cape floods, it's crucial to address the immediate health needs while also considering long-term solutions to mitigate the impact of climate-related disasters. The South African Medical Association has raised concerns about exposure to waterborne diseases like typhoid and cholera in the aftermath. The disruption of healthcare systems will also be exacerbated by the situation. And for more on this, we now speak to South African Medical Association Chairperson Dr Mvuyisi Mzukwa, and he joins us now via our video link. Dr Mvuyisi, thank you so much for your time this evening here on SABC News. Now, we have seen the floods and the devastation it has had on the community of Mthatha in the Eastern Cape. Also there, the damage to infrastructure and what this also means for waterborne diseases. What is your take as the South African Medical Association, particularly around your concerns around waterborne diseases during this period as that community rebuilds their lives?
Good evening to you, Mbali, and to your viewers, and thanks for having me in your program. First of all, Mbali, on behalf of the South African Medical Association, allow me to extend our deepest sympathies to communities, individuals, and communities that have been affected by this devastating flood in the Eastern Cape. The other thing is we would like also to, to express, the fact that our thoughts and prayers are with those communities who have lost their loved ones, their homes, and their livelihoods in these devastating floods. We are particularly concerned, though, about the immediate and the long-term implications on the healthcare system and health in the Eastern Cape. We know already that our colleagues are on the ground working very hard. They have been again, called upon to rise to the occasion and work under these difficult times. We as the South African Medical Association, we stand in solidarity with our colleagues on the ground, and we know that they've been working under challenging times. Coming to your question regarding these waterborne diseases, we know that there are a lot of conditions that could arise from this. For example, like you said, things like cholera, typhoid, dysentery. You could also get things like hepatitis A, hepatitis E, and many other gastrointestinal diseases, because obviously this flooding would mix with sewage and many other things that are around there. There is also contamination of water resources. There is destruction of infrastructure. There is overcrowding in the halls or in the shelters. So you'd expect that when people don't have access to water, so that they can maintain a good hygiene, so they will contaminate each other. And as you already heard from the media already, there are issues of diarrheal diseases that have already erupted in that area. So it is important that we stress that.
And Dr. Mvuyisi, when it comes to, what can be done right now to assist the community, because, we have seen those reports where, the issues around water contamination have been raised. What needs to be done from a healthcare point of view to assist the community of Mthatha, particularly right now when they are faced with this issue, and also to ensure that we don't see a complete outbreak of cholera in that region?
I think the first thing, Bali, is that government must show leadership. They must work in an integrated way. They cannot afford to work in isolation in these cases. But there must be, a provision of water in those areas. You can imagine that, there's damage to infrastructure. So they need safe drinking water. They also need, clean water around them, so that for hygiene purposes, but also for other reasons, like if you want to cook and stuff like that. But there must be that public awareness. People must be made aware of what could happen if they do not wash their hands and stuff like that, and how to avoid, the challenge of diarrhea and all these other things. But also we do need to address the long-term effects. Those long-term plans include working on the infrastructure. We must make sure that in the rural areas there's good infrastructure in terms of clean running water. The Eastern Cape has been neglected, especially the rural areas, where you find that there is no running water, clean running water. People are still depending on the rivers. They are still depending on dams and all these things, sharing that clean water with animals. So government really needs to change their mind when it comes to the rural areas in the Eastern Cape and other provinces, by the way.
All right. Thank you very much, Dr Mvuyisi Mzukwa. They're giving us an insight in terms of the impact that the devastation in the Eastern Cape will have in terms of a healthcare point of view.